Good afternoon, everyone. Thank you for joining PHCA for today's webinar, Is Your Business Ready to Reopen? What you need to know. I hope everyone is doing well and staying healthy during this ongoing challenge with COVID-19. We recognize the extraordinary work that you've been doing through the crisis, and we thank you for all that you're doing. I'm Wendy Johnson with the Pennsylvania Healthcare Association. Before we begin, I have a few housekeeping items to cover. PHCA offers monthly webinars to members to receive updates from department staff on regulations, learn from industry experts on current trends and practices, and to gain a better understanding of practical application tools to equip you so that you may continue to provide the highest level of quality care possible. This webinar is being recorded and will be made available on the PHCA website. The webinar has been approved for 1 continuing education credit for PHCA members and future members as part of our ongoing effort to educate everyone and have everyone working together through the COVID crisis. Credits will be uploaded to NAB later today, since we know that some of you have a deadline coming up of early next week for those credits. So they will be uploaded either later today or tomorrow at the latest. A survey will be launched at the close of the webinar, which is different from the way we've done things in the past. Your feedback is important to us and our speakers, so please take a moment to complete the survey. All attendees will be in listen-only mode. However, throughout the presentation, please feel free to submit your questions using your questions pane on the right hand of your screen, and our presenter will address them at the end of the presentation. Today's webinar is being presented by Robyn Colajezzi, Director of Commercial Marketing with ServPro of Germantown, Upper Bucks, Pennypack, Bustleton. The coronavirus has had major impact on long-term care facilities throughout the U.S. During today's presentation, our presenter will review what's known and unknown of the COVID virus and the Pennsylvania Department of Health orders and requirements for businesses. Our speaker will be discussing the new normal cleaning standards and HVAC considerations. We will also go over post-pandemic decisions for business owners and back-to-work guidance. I'll now turn the webinar over to Robyn.
Great. Thank you, Wendy. Thank you, everybody, for joining us today. I hope everyone is well and healthy, and hopefully today you will learn a little bit more about this pandemic and how to continue operating in a very safe and mandated way according to the governor's rulings. So I'll get started right away. First off, again, my name is Robyn Colajezzi. I'm the Director of Commercial Marketing with ServPro of Germantown, Upper Bucks, and Pennypack, Bustleton. However, we are a franchise system that does work throughout the entire state. Many of you we probably have done some work with. And Mike McRory, one of the co-owners, sends his regards. He was unable to make it today. He had a family emergency come up, and but he sends his regards. So it will just be me today. Okay, so real quick to review what we're going to go over. The first part of this, we're just going to review SARS-CoV-2, a little bit of the unknown and the known, and we're going to review the PA Department of Health orders and requirements for businesses. Then we'll get into, everybody calls it the new norm, but for us, the new norm is about cleaning. We're going to touch base on employees versus professionals, what the various cleaning processes are, including cleaning versus decontaminating versus sanitizing. We'll review the cleaning protocols for Cat 1, Cat 2, and Cat 3, and I'll explain all of them as we move on. I will also cover information on equipment, chemicals, and PPE, and then we'll touch base on the HVAC considerations. And then part 3 of this program today will be our guide to staying open and reopening your offices. And this includes a whole guide to content manipulation. There's a lot of difficult decisions that business owners, managers, HR managers, everybody that needs to consider when bringing people back to work. Many of you probably do have people back to work and still have your facilities open. But we will review developing an infectious disease response plan, going over your cleaning schedules, how to create a 6-foot social distancing workplace, touch point adjustments. We'll talk about directional movement and maps for facilities and office buildings. We'll talk about signage. We'll talk about creating rules and communicating those rules, and we'll touch base a little bit on being flexible employers and managers. So you know that everything in this presentation today, here is a list of all the resources. I have been giving this presentation since March 22nd, I believe was the first time I gave this presentation. It has evolved about, I'd say a good 40 times since March. I gave that first presentation to the Pennsylvania School Board Association. And as this coronavirus evolved, our situation evolved, my training evolved, my certifications evolved, so has this presentation. And I find I'm updating it almost weekly. But these are the resources that all of my information is based off of. So I do like to touch base on the unknown. I love this quote: what we don't know, what we don't know, and nothing can change what we don't know. We don't know how to definitively kill or stop this disease from spreading. There's a lot of theories, there's a lot of science occurring to prove those theories, but we still don't know. We don't know if it will continue to mutate. There's all this talk about the fall resurgence and reemergence that we're going to see when the colder weather hits. But being that it is a novel coronavirus, we don't definitively know exactly what will happen. We don't know who or how many people will die or be infected. Our state is working wonderfully at keeping track of the infections and the trace tracking of them, but ultimately we do not have a crystal ball to tell us what the end numbers are going to be. And we don't know how long this will last. We're all waiting for a cure, we're all waiting for a vaccine. We all hear different dates, different time frames. Again, we don't know what we don't know. And I hate to say this, but we are the guinea pigs, and we will be that generation that determines going forward everything there is to do and know about SARS-CoV-2. I'm going to review a couple things that we do know, and some of this will seem very redundant to many of you. Social media has taken a foothold on spreading information, but I think it's important just to kind of review, so when I get into the cleaning parts, you will understand why I'm reviewing them now. But so SARS-CoV-2 stands for Severe Acute Respiratory Syndrome Coronavirus 2. SARS-CoV-2 is the virus strain that causes coronavirus disease 2019, COVID-19. I like to compare this so people understand it, that many of us lived through, but the virus HIV was the virus that caused the disease AIDS. SARS-CoV-2 is the virus that causes the disease COVID-19. In my industry, I see a lot of companies claim that they can kill COVID-19 with their cleaning products, and unfortunately, you can't kill the disease in cleaning. You can kill the virus, or you can decontaminate the virus, but it's very clear to understand the difference between the virus and the disease. I apologize, my mouse is a little slow with flipping some of these pages. There's a lot about the novel coronavirus that causes this disease, but what we currently know is that it is a virus similar to those that cause SARS and MERS, but we do know that it spreads person to person, usually within about 6 feet. Transmission of SARS-CoV-2 to persons from surfaces contaminated with the virus has not been specifically documented. Transmission of coronavirus occurs much more commonly through respiratory droplets than through objects and surfaces like doorknobs, countertops, keyboards, and toys. I like to point this out because most of the documented cases are not being traced to surface. They're being traced to being next to or near a person that has been diagnosed. However, there's no way to rule out that you were at a party or at a function where somebody has tested positive, and can you actually trace that that person touched the spoon to the fruit bowl 10 minutes before you did? Again, there's just a lot of vast unknowns to this, but knowledge is power and logic is power. But what we do know is SARS-CoV-2, it needs a means to survive, which are hosts. That would be us. It needs a possible means to survive. So again, this could be the fomites like hard and soft surfaces, hair, clothing, pants, plants, paper. Again, there's that potential airborne longevity. And what we do also know is that SARS-CoV-2 is an envelope virus. And you may have heard this before, but that is good news when it comes to cleaning the virus. The envelope viruses are enclosed with a lipid that can be dissolved, whereas non-envelope viruses lack that bilayer lipid membrane and is very heat resistant. And some examples of envelope viruses include influenza, measles, HIV, and now SARS-CoV-2. To compare that to non-envelope viruses like polio and hepatitis A. Again, this is good news for the cleaning and disinfecting of SARS-CoV-2. This is a study out of the New England Journal of Medicine, the stability of SARS-CoV-2. So again, there's a lot of different information on how long it lasts in the air, how long it lasts on surfaces. So the best we can do is take what science is documented, and as it changes, stay up to date on it. But you'll see here, aerosols have a half-life of 2.74 hours. With a detection limit of up to 3 hours, copper up to 4 hours of a detection limit, cardboard up to 24 hours, steel up to 48 hours, and plastic up to 72 hours. When discussing what the Pennsylvania Department of Health has released in their guidelines for all businesses, regardless of what type of business we're discussing. Cleaning, disinfecting, and other maintenance and security services performed by building service employees are critical to protecting the public health by reducing COVID-19 infections in the Commonwealth. Businesses shall, and when this is being mandated from the Department of Health, shall means you must. As applicable, the following social distancing, mitigation, and cleaning protocols. Clean and disinfect high-touch areas routinely in accordance with the guidelines from the CDC. Maintain pre-existing cleaning protocols established by the business for all other areas of the building. Establish protocols for the execution upon discovery that the business has been exposed to a person who has a probable or confirmed case of COVID-19. All of this can be found and is taken directly from governor.pa.gov. The state ordered requirements for communicating with employees and any on-site customers. And this is probably the most important thing to keep in mind. But any business conducting in-person operations or serving the public are required to make employees and customers aware of the guidance provided by the Commonwealth to keep people at their establishment safe. Publicly acknowledge your responsibility to conduct their operations to ensure the health and safety of the customers and employees or patients. Businesses must print, sign, and post the COVID-19 safety procedures for businesses flyer on their premises. Businesses must post the signed flyer in employee common space, and if the business serves the public, the business must also post the flyer near the business's public entrance in prominent locations. This flyer must be signed by the corporate office, site manager, site foreperson, or the equivalent. The flyer also contains a space for the business to indicate that employees or an employee who serves as a pandemic safety officer is also listed in the safety procedures for the business. Again, all of this can be found at the link that is attached as well. And I believe this presentation will be made available to you all offline as well. This is what it looks directly like. This is what you need to actually print out and sign and post. I won't go through everything on this page, but again, everything is on pa.gov, but this is exactly what needs to be printed out in accordance with the directives from the Department of Health for all businesses operating in the Commonwealth. Here's an example of what you need to create and have your employees sign off on. This is something we did here at ServPro locally, and the most important part is what I've enlarged here. But this is to have your employees acknowledge and sign and date that they understand your infectious disease protocol. And this needs to be placed not only in their HR file, but as well as giving them a copy as well. So that review tells us, what does this all mean for our new norm? And in most of our worlds, it's about cleaning. Unfortunately, part of our new norm in this environment is that we live in a litigious country. I Googled this. Look, you can see the dates here are April, back in early April when I put this into this presentation. But lawsuits are already occurring from coast to coast, where people getting infected while on the while at work can be very detrimental to our society as a whole. What we're going to review will help protect yourself, will help protect your employees, and will help protect your business. It's most important that you do absolutely everything in your power and follow all protocols as best as you can to protect yourself from any form of litigation. When talking about employees versus professionals for cleaning, this hierarchy of controls, when you have something like the coronavirus, the ideal situation is elimination. Physically remove the hazard being coronavirus. And this is from OSHA. And again, I do try to link everything that I share in this presentation. As we go down, it goes to substitution. You replace the hazard. Then you look at your engineering controls, so you isolate people from the hazards. Administrative controls or change the way people work. And then last is protect the worker from with personal protective equipment. A virus with the potential of killing 2 to 5% of the people that it infects is considered a biological threat capable of being immediately dangerous to life or health, IDLH. According to OSHA, workers should be properly trained and protected with the appropriate personal protective equipment when dealing with a virus of this potential. We have learned that all employees or professionals, you need to ask yourself a couple of questions. If you're using your regular employee janitorial staff to clean your offices, your facility, your building, are your employees trained in infectious disease control protocol? Are your employees trained in proper chemical application and cleaning? Do your employees have appropriate PPE, personal protective equipment? And do they know how to use it? We'll cover that a little bit later. Whether you're open or reopening, you must treat your facility as if there has been an identified case of COVID-19. And this is due to the dormancy rate and the amount of people that will walk through your doors every day to do business. Anybody cleaning for this virus needs some level of OSHA, bloodborne pathogen, or HAZWOPER training. And this is what is recommended by the CDC and OSHA. I can't tell you how important this slide is to consider when using employees versus professionals. And by no means am I saying regular janitorial employees or your regular staff cannot handle this, but they need the proper training and the tools to do it safely and effectively. In regards to cleaning levels, it is important to understand the different levels of cleaning that may or may not be possible for each surface. All surfaces can be cleaned, many surfaces can be sanitized, and only some surfaces can be disinfected. The three types of cleaning levels are general cleaning, sanitizing, and disinfecting. General surface cleaning is pretty much what we all do at home. We're cleaning surfaces. It is accomplished with water, detergent, and physical scrubbing of the surface. General cleaning removes visible dirt, organic matter, viruses, fungi, and bacteria. It removes microbes if possible, but it does not kill them. Most microbes cannot live, though, on dry, clean surfaces very long. In regards to sanitizing, when you're sanitizing, it reduces, but does not necessarily eliminate all the bacteria on treated surfaces. Registered sanitizers must show a reduction of at least 99.9% in the number of each type of bacteria tested on non-food contact surfaces. Examples of non-food sanitizers generally and usually include carpet sanitizers, air sanitizers, laundry sanitizers, and toilet bowl sanitizers. But keep in mind, sanitizers do not have claims for viruses or fungi. Disinfecting, the third form of cleaning, works by using chemicals to kill germs on surfaces. However, disinfecting does not remove germs or clean dirty surfaces. In the world of cleaning for this virus and any viruses, or really any biohazard, we have to do a series of general cleaning as well as disinfecting, because the two do not do the same thing. But disinfecting does destroy and irreversibly inactivates infectious microbes, but it does not necessarily kill the spores of bacteria or fungi. But COVID is not bacterial or fungi. In regards to COVID-19 cleaning specific, there are three categories. Cat 1 is proactive cleaning. Cat 2 is a PUI, or a person under investigation, otherwise a possible exposure. And a Cat 3 cleaning is a confirmed positive case of coronavirus. Cat 1 cleaning details for proactive is that there is no active known threat of COVID-19 contamination or exposure. In proactive cleaning, the CDC encourages cleaning of high-touch, hard surfaces. Counters, tabletops, bathroom fixtures, toilets, keyboards, tablets, computers, doorknobs, phones. Again, cleaning removes the soil and dirt that harbors the infectious agents, while disinfecting kills the remaining environmental pathogens. Cleaning is a necessary first step in disinfecting a surface. Both cleaning and disinfecting must be a part of the scope of work. And here's actually a picture of us cleaning those high touch point areas on a Cat 1. In a Cat 2, this is where there's a possible. This is where you might have an employee that says, oh, I was at a wedding this past weekend and we found out one of the guests has tested positive, and now I'm going to get a test. I feel fine. But they have now fallen into another category of a PUI, person under investigation. Cat 2 cleaning includes everything in Cat 1, but also includes cleaning and disinfecting of high-touch, non-porous surfaces, as well as cleaning and sanitizing the high-touch porous surfaces. So some examples of those porous surfaces include drywall, carpeting, wallpaper, acoustic ceiling tiles, wood. This takes it to another level of cleaning in case that person is infected with COVID-19. And then the Cat 3, this is the enhanced cleanup. This is required for confirmed positive diagnosis of COVID-19. And quite frankly, we at ServPro, we have been treating Cat 2 and Cat 3 pretty much equal in this pandemic because of the vast unknowns. Again, we're sending our workers into hazmat situations 24 hours a day, 7 days a week. So a lot of companies, my understanding, are treating Cat 2 and Cat 3 pretty much the same. But this enhanced cleaning also includes cleaning walls up to 8 feet, but this also excludes the ceilings. We do a combination of high touch-up cleanup and enhanced cleanup may be needed within a structure based on where the infected individual has directly traveled or occupied. This requires more man hours and more equipment and is much more thorough. We have a company here we're in Upper Bucks County, outside of Philadelphia. We had we've been doing proactive cleaning once a week at a local manufacturer, and then they had about 3 weeks into it a positive diagnosed case. So we had to go back through and literally trace everywhere that employee had been and do an enhanced cleaning of Cat 3. The most important part with cleaning, as well as any training, is the proper gear. For Cat 1, again, this is proactive, this is regular cleaning, this is no known cases. An N95 respirator mask, nitrile gloves, and goggles. They're ANSI Z87.1 rated. Those are the proper pieces of PPE for Cat 1. You could also use the KN95 respirator masks that are equally as effective as N95. For Cat 2 and Cat 3, this is where we are required to take it up to the next level. You need a full face respirator with a P100 filter, 99.9% of particulates at 0.3 microns or larger. In regards to gloves, you are required to wear 2 different colored gloves, and this is recommended for tear detection. You wear a 4 mil nitrate outer glove over a 5 mil long cuff inner glove. Again, this is just to be more proactive in case there is any breach to the outside glove. Coveralls with attached hood and boots with a storm flap over zipper. And then we use duct tape, as you can see in this picture, to secure gloves to the coveralls. I can't tell you how many times our technicians who go through thorough training, we use a substance, I'm not sure what the name is, it's a testing substance, it's a gel, it's a clear gel, and we have them don and doff their PPE. And after they put the PPE on, we splatter this clear gel on them several times, and then they are required to doff or take off the PPE. And then when we take the black light after they're back into their regular clothes, you take the black light over them to see if they cross-contaminated any of that gel onto themselves. And most technicians will fail that test 4 or 5 times before getting it right. So again, going back to having cleaners that are properly geared and protected from being able to cross-contaminate. In regards to the chemicals and products used to clean for SARS-CoV-2, the EPA provides a complete list of registered products. They currently right now have about 250 different disinfectants that, while they do not claim to kill SARS-CoV-2 directly, they claim that the likelihood of them working against SARS-CoV-2 is good because it is a claim against MERS and SARS from before. They do work on other coronaviruses, so it's likely they do work on this coronavirus. But there is a disclaimer, just so you know, that again, a new virus, we're still testing everything out. On all cleaning bottles on the back, this is what you want to look for. It's an EPA registered number with a barcode. This is just off of one of our bottles of ServPro Oxide, which is one of the products that we use at ServPro. It's one of our go-tos for overall effectiveness, as well as a very low toxicity rating. These are some other different cleaners that we use, but again, there's 250 of them on the EPA, and that actually may have increased since the last time that I looked. But it's very important that you do read labels and make sure you are using correct products. Unfortunately, there are a lot of claims out there of people selling products that kill SARS-CoV-2 or COVID-19 that aren't EPA registered. And again, when it comes to operating a business or a facility, you want to make sure that you're protecting yourself by using EPA approved chemicals. In regards to different types of equipment, one of the things we use, and there are several different name brands out there, but hydroxyl is a green technology, and it's one of the industry's most advanced air purifiers and decontaminating contents and surfaces, and it actually removes stubborn odors incredibly well. It's this little box that gets plugged in, and they actually, they're amazing on how well they work. But I am not a technological person, but technically I have written here exactly how it works. It's a UVA ray that is emitted from the titanium dioxide lamps where the air passes through and it forms electrons, and basically it decomposes and eliminates that organic and inorganic gases and air pollutants. This is an excellent piece of equipment that can be used in restaurants, grocery stores, assisted living, airports, hotels, movie theaters, offices. We are currently working with Pennsylvania CareerLink, and because of their high increase of traffic on a daily basis into their computer lab areas, we have rented them one of these in their lobby to run all day, just to try and keep that air a little bit more hygienic. The other key piece of equipment for cleaning SARS-CoV-2 are foggers. Sometimes you'll hear these called a sprayer or a mister. They're an ultra low volume, and it's ideal for distributing the disinfectants throughout a space. I would say probably 70% of our SARS-CoV-2 cleanup is with a fogger. They are ideal for reaching every nook and cranny of an office, a lobby, a desk area, under furniture, around furniture. It's ideal for ventilation ducts and for carpeting. It is a very, very fine mist that is sprayed everywhere, and the disinfectant lands and settles. So hard to reach spots it's key to use something like this. We work with several facilities that will have us come out and fog, and then they will have their janitorial staff follow up with a wipe down. So it's like a two-step thorough cleaning after being open all week. In regards to HVAC, so when I started doing this presentation, was 6 months ago, are we in? 7, I think. Seems like a year. When I first started doing this, the CDC did not recommend HVAC cleanings against coronavirus. But as offices and facilities were reopening up, it was bringing this back up into conversation about recirculated office air. Since then, we have gotten word from ASHRAE, A-S-H-R-A-E, which is the American Society of Heating, Refrigerating, and Air Conditioning Engineers. They have released a statement on the operation of heating, ventilating, and air conditioning systems to reduce SARS-CoV-2 transmission. Basically, transmission through the air is sufficiently likely. And again, I keep going back to the beginning of this presentation. There is still so much we are learning, and we'll know in a year from now, we'll know so much more. But right now, this is where we are leading, that HVACs need to be looked at because they can potentially be spreading SARS-CoV-2 if they are getting into the system. So this is just something to keep in mind, that as it's evolving, we are trying to bring the information to our guests as best as we possibly can. Now we're going to get into the post-pandemic planning. These are environmental changes to office spaces, facilities, businesses. Again, any space that people are going to be either working at or being customers or being patients. Again, our new normal. One thing that astonishes me a lot is how, over the last 4 decades, the American Workspace has kind of changed a little bit. It's steadily shrunk, and a lot of places became, more open, where everybody shares like one room and one big table. And this is important because, everybody went home. March came and the world shut down, and everybody went home to learn to work from home. And now we're bringing panicked employees back in after the pandemic, or during the pandemic. So we really have to think these things through. The COVID-19 crisis, it has fast forwarded our future of work by as much as a decade. We have all become experts at telecommuting, Zoom meetings. We're used to our kids screaming in the background, our dogs jumping on our laps. This has become a more standard practice overnight, and it's something that you need to consider when you're working with employees that you're now asking to come back into the workspace. I know in our case, my team, I have several people on the marketing team, and they have worked longer and harder and more efficiently working from home, that we're considering it to be a permanent change for the way that we do business. This back to work guide will hopefully help you when thinking about things that you can do to create a safer work environment. Now, again, this was written a little while ago, and many of you may be reopened, but it's still timely. But whether you're reopening or your business is open, you want to provide your entire building and office a thorough cleaning, as aforementioned. You want to adjust your cleaning schedule and protocols. That's something that we'll discuss in a little bit more detail. You need to develop your infectious disease preparedness and response plan. You need to create and/or reconfigure your spaces to encourage better hygiene and social distancing. Marking all 6-foot personal space areas. You want to make adjustments to all touch points. You want to label all directional traffic. You want to create rules, and most importantly, you want to communicate the rules. And we'll talk a little bit more about each one of these. And lastly, you want to be flexible, and we'll discuss that a little bit. I'm having a hard time advancing my slide. Oh, there it goes. Sorry about that. So developing an infectious disease preparedness and response plan. Again, this was working with OSHA directly, but if one does not already exist, you do need to develop an infectious disease preparedness and response plan that can help guide and protective actions against SARS-CoV-2. This will help you stay abreast of guidance from federal, state, local, tribal, and/or territorial health agencies, and consider how to incorporate those recommendations and resources into your workplace-specific plans. Such considerations you want to think about. Where, how, and to what sources of COVID-2 might your workers be exposed? General public, customers, coworkers. Also, sick individuals at high risk, that are particularly high risk of infection. Do you have international travels? Of course, your healthcare workers, they may have had unprotected exposure to people who have known or suspected of having COVID-2. The non-occupational risk factors at home and in community settings. Workers' individual risk factors, their age, their presence of chronic medical conditions, including any immunocompromising conditions, including pregnancy, All these things are controls that are necessary to address these risks. In addition, things you need to think about. I always say, like, when disaster strikes, it never tells you when. None of us expected when March started that we would have a pandemic on our hands. And, I always say when Noah built the ark, it wasn't raining. So situations, you have to think ahead, situations that could arise from outbreaks. You might have increased rates of worker absenteeism, the need for social distancing, staggered work shifts, downsizing operations, delivery services remotely, and other exposure reducing measures. Options for conducting essential operations with a reduced workforce. How will that work? Is there cross training involved? Can different jobs take on different operations? These are all things you really need to think through. You also want to think about your interrupted supply chains or delayed deliveries. We, being biohazard cleaners, had faced a shortage of PPE, as did all of our frontline workers, that our country wasn't prepared for. So, lesson learned, but these are things that you need to consider as you go forward. You want to develop policies and procedures for prompt identification, isolation of sick people. If appropriate, you want to develop, implement, and communicate about workplace flexibilities and protections, implement workplace controls, and follow existing OSHA standards. Adjusting your cleaning schedules and protocols. If you have an on-site janitorial staff or third-party professional, certified restoration cleaners, you want to increase their schedule. You want to increase cleaning levels to include not just general cleaning, but including disinfecting too. Keep in mind, your entire facility can be completely disinfected and cleaned. The second the doors open and a new person walks in, you risk the exposure of cross-contamination. As I mentioned when we talked about the fogging machines, added weekly fogging and/or deep cleaning is always a good proactive measure. Again, consider the HVAC cleaning. And this is important and something very simple. Ask your employees to declutter their offices and desks to only mandatory items. Pictures, knickknacks, all those things, they should be boxed up and removed during this pandemic until we know further, and to make cleanup a lot easier and quicker. Oops, sorry, I accidentally changed screens there. So let's talk about creating that 6-foot workspace to promote that better hygiene and social distancing. Again, this core premise is to ensure that 6 feet is the recommended measurement. I know there's been some social media and media in the last couple of weeks that had said there was an increase of 18 feet indoors for indoors. I have not seen that come documented yet, so I'm sticking with that 6-foot workspace recommended measurement. As I mentioned a little bit earlier, office spaces today in office facilities, we have this open concept. We, share desk space. There's open areas where people bring their laptops, and that might not be an easy thing to remedy. You can't just start putting up walls or you can, but it's much more costly. So if you're faced with an area that is more open, you want to be able to mark areas as clear as possible, and duct tape can mark areas in a pinch. But I am seeing an influx on even Amazon, Staples, WB Mason of a lot of materials for office and facilities to have their buildings marked. There's 6-foot circle rugs, there's signage, and we'll get a little bit more into that. Bringing back cubicles like we did, this changed a lot after the last recession, but this is really an important long-term fix to consider. People working in an office space, having their own area to keep them to themselves and to keep clean not only helps for hygiene reasons, but it also helps give a little bit more sense of security to employees. So some touch point adjustments, again, our world has changed, and with employees now being back with other people, it's something to consider. But these are a review of certain touch points that are high touch points. We're going to talk about permanent fixes as well as temporary fixes. In regards to doors, permanent fix, you're going to see all automatic doors, at the very least swinging doors with kick plates where appropriate. As a temporary fix, maintenance people have been removing doors just altogether where appropriate. Obviously, you're not going to remove a bathroom door, but office doors, even conference room doors where appropriate, by eliminating the hazard, as you remember from that chart, but by eliminating, it helps reduce the potential. One of the other things that became very popular a decade or two ago was big company kitchens. Some of them have stoves and microwaves and sinks and big refrigerators, and everybody gathers in there. And well, quite frankly, that's probably the biggest petri dish of the office where people can cross-contaminate. So I anticipate that we'll see an elimination of company-wide kitchens altogether, especially for larger companies. But in the interim, banning the use of kitchen appliances is pretty much a really good move. I have worked with some companies that have eliminated their communal refrigerators and have purchased these little desktop mini refrigerators for people to have their own at their desk. Or some places I've seen where they have like 10 cubicles in an area where 10 people work, where they've turned one of those cubicles into a quote unquote break area. There's just one smaller refrigerator, and that's only used and touched by those 10 people. It's a control that you can manage better with less people. Bathrooms, you want to increase sanitary wipe stations and dispensers, and you want to increase cleaning. Desks, for desks, you might want to consider disposable desk pads. I don't know if they're available yet. I understand they are coming, but in the interim, construction paper, art paper can be purchased at Staples, probably Amazon. When people come in the morning and they take their disposable desk pad, it helps keep their desk area and workspace clean. And phones are just going to go away. We're going to be voice activated for all our communication devices. This is a sample of a directional map for an office space, but every facility should have something like this posted. And my contact information is here. I'm happy to help anybody do this. It's actually I've done it for several companies, but basically you want to determine whether you're going to move counterclockwise or clockwise, and whichever way you decide, that is the rule of your facility. And as you'll see here, you come in the office space into the lobby. If I was coming in and going to the conference room, I can't just zigzag into here. As the directional map, I need to go around the long way to get to the conference room, enter and exit different doors. And this is really designed to have less contact between people, less closeness between people, and to keep a level of order if you have a lot of employees working in one small area. Here are some examples of signs. You can get everything from directional traffic signs, one way, you better stop right here, reminders for social distancing. Many offices I've worked with have actually put up do not enter and stop signs on office doors. That has become part of their protocol and their rule to do not enter an office. You can stand at the door to have that conversation. And then obviously you love these reminder signs. Cover your cough, clean your hands, all important. Here's an example. This is just a sample rule list, but you do want to create rules for your facility, your office, your business, your center, and post them. Create these and post these. Be welcome at work, but always act responsibly. Stick to the rules, follow the signs. Stay safe at 6 feet from each other and wear masks. Walk the office counterclockwise or clockwise if you choose, everywhere. Enter and leave meeting rooms as indicated. Replace your desk pad daily and leave a clean desk. That is just an example of some sample rules. Again, every single company I'm working with, every business is different. What works for one might not be the same for another. So this is where, when developing that infectious disease protocol, your plans, you need to create this list that's going to fit your employees and your facility. And again, create basic reminders about good hygiene, washing your hands. I mean, we saw the shortage of hand sanitizers this pandemic brought us to, but remind people to avoid touching their eyes, their nose, their mouth, avoid close contact with people who are sick, stay home when sick. This includes staying home from work, school, errands, travel. These are just good things to remind, and messaging that you can post as well as on any employee portals you may have or emails. And lastly, and very importantly, is remember to be flexible. This is our new world. We are learning, we are adapting, we are still figuring it out, but it's important to remember that the oldest and strongest emotion of mankind is fear. And the oldest and strongest kind of fear is the fear of the unknown. There are some people that are not scared of this virus at all, and we have people that don't want to wear masks, and then we have people that are just trying to do their part and wear masks, and we've got everybody in between. I'm not saying anyone is right or wrong, but all we can do is be flexible, knowing that your employees are your most important asset right now. So you need to work with them. You need to be empathetic. You need to be positive. You need to acknowledge fears, be accepting, help reduce stress, offer assurance, and all of this is best done by communicating an effective plan. This is our infectious disease plan, and this is what we're going to do going forward. I have a company that right now started a 12:30 Zoom meditation minute. So for like 15 minutes, they all get on Zoom and they do a meditation guide just to help keep stress levels down. I know that's not always ideal or practical in a lot of work situations, but just to keep that, your creativity out there of what you can do to offer a little bit more stress reduction. And that is pretty much the end of our presentation, and looks like right on time. 52 minutes is usually where I wind up. And Wendy, sorry. I'm not sure if you are looking at the questions, if there are any, but we have some time here to discuss any questions anyone might have.
Yeah, absolutely. Thanks, Robyn. That was great information. I think I know where I'm going to be this weekend. I'm going to be cleaning my office and boxing things up. So thanks for that.
It really is important.
I know. I'm like, oh, I've got some work to do there. At this time, we will open up for questions and answers. Please type those into the question pane on the right hand of your screen, and we will answer those. We do have a couple minutes left here, so go ahead and type in any questions that you might have. I know we did have some questions around whether we would be getting the handout out to you, and we will follow up with that likely tomorrow. I'll get the slides from Robyn, and we will follow up in an email. We'll have her information, contact information in case you have any questions that you think of afterwards.
Absolutely. And I do want to reiterate, I'm being sincere. If you need help with certain things like a floor plan or even guidance to the proper forms or writing any of this, I'm here to help, and that's just in my nature. But please don't hesitate to reach out. I can help anybody in that guidance.
Great. We have a question that has come in. How about the use of high intensity UV lighting in air handling?
That is great. I am not very knowledgeable on the specific devices, but what I have heard and learned is that yes, the UV lights are definitely helpful in eliminating the virus.
Great. We still have some more time for questions. If anyone has any, please type them in. We'll get those answered. We do have a couple of minutes. If not, we'll give you some time back in your day. Don't forget to complete the survey. When I close the webinar, that will pop up. It's just a quick survey. It is helpful for us and for our speaker. Today's webinar is being recorded and will be made available on the PHCA website. And look out for more PHCA webinars that are coming up. We do have one scheduled in October with the Alzheimer's Association, and they have some new tools that they're rolling out this month. So we'll get the breaking news on those initiatives that they are undertaking right now. And our convention, our unconventional 2020 PHCA convention registration is open. The final educational offerings agenda will be made available soon. All right, I don't see any more questions. I just want to thank Robyn again. This was really great and timely information. It's, you know, even if we know it, I think it's stuff that it's always good to have reminders on, you know, because we tend to slip up and, you know, get a little lax in our you know, in our day-to-day routines. So it's always good to have the reminders and then get some new information. So thanks again to Robyn, and I just want to wish everybody a great remainder to your day and stay well, please.
Thank you, everyone. Have a wonderful day.